Vaginal atrophy is an uncomfortable, sometimes painful condition that affects a large number of women, many of whom suffer in silence. For those who find traditional treatments ineffective, there is a procedure to counter the symptoms. You are listening to ReachMD, and I am your host, Dr. Patrice Basanta-Henry. Joining me today is Dr. Benita Stephens, a board-certified OB-GYN and owner and founder of Ciao Medical Center and Spa in Atlanta, Georgia. Today, we will be discussing vaginal rejuvenation. Dr. Stephens, welcome to ReachMD.
Thank you.
So what exactly is vaginal rejuvenation?
Well, vaginal rejuvenation is really when we're trying to restore the vagina back to its youthful state, back to that time prior to childbirth, prior to injuries that may have occurred during childbirth, and prior to the menopausal state.
So how long has this procedure been available in the United States, and is it FDA approved?
Yes, the Mona Lisa Touch procedure is FDA approved, and it's been in the United States since 2012.
Who are prime candidates and who are not candidates for this type of procedure?
So typically, we would offer this procedure to any woman that is experiencing symptoms of menopause, women who have issues like vaginal burning, itching, if they're having some pain or discomfort during sexual intercourse, if they're having burning with urination, any of those symptoms that would be due to reduced estrogen in the vaginal area. Another good candidate for the treatment would be someone who suffered from something like breast cancer and they're unable to use any type of hormones to help to improve the vaginal tissue through estrogen.
So who would you say are not candidates for this procedure?
So typically we wouldn't want to offer this, of course, always pregnant women. We always have to state that. Or anybody who's within 3 months of being postpartum. If they have prolapse beyond the hymen, if they've had reconstructive pelvic surgery with something like a mesh kit. If you know that the woman has impaired wound healing, then that would also be someone who you wouldn't offer the treatment to. And also, of course, if you have an active vaginal or vulvar infection like herpes or any other type of STD.
So once we've identified our candidates, how would this procedure work for the patient?
So typically the patient comes into the office. We do a history and physical like usual, make sure that they don't have any contraindications to the treatment and make sure that she is an appropriate candidate. And then once that happens, we're able to do the treatment the same day. It typically takes about 5 minutes. It's done in the office. There's no anesthesia required. There's not very much downtime in between having the procedure and resuming your usual activities. And we usually do about 3 treatments about 6 weeks apart.
Once the treatment has been performed, what type of symptoms should the patient see an improvement in?
So all of those symptoms like the dryness, the itching, the burning, the painful urination, the pain with intercourse, typically patients are noticing improvements after the very first treatment. For some candidates, it may take the second or the third treatment, but on average, immediately, they're starting to see improvements where a lot of women who were not able to even have sexual intercourse prior to the treatment are now able to.
Okay, so kind of walk me through this procedure. If I was a patient and I'm laying on the bed, what's going to happen?
We put you up in the traditional dorsal lithotomy position with your feet in the stirrups. If I've never examined the patient, then typically I will do a brief exam just to evaluate the tissue and make sure that it looks like it's in a menopausal state. I usually assess the pH of the tissue just for historical purposes and to make sure that they don't have any signs of any infection. And then we get the probe ready. We put towels around the legs, cold towels to protect against exposure from the laser. And we give them glasses to wear to protect their eyes. And then we use the probe. The probe is a little bit larger than a speculum, the average speculum, and we are inserting the probe into the vaginal canal, and the probe was drawn successively about 1 centimeter as we go through the treatment, rotating the probe in sort of a clockwise fashion while deploying the laser.
If you are just tuning in, you are listening to ReachMD, and I am your host, Dr. Patrice Basanta-Henry. I'm speaking with Dr. Benita Stephens, a board-certified OB-GYN and owner and founder of Ciao Medical Center and Spa in Atlanta, Georgia. we're discussing vaginal rejuvenation. So, Dr. Stephens, are there any risks to having this procedure done, or are there any long-term complications?
No, we really haven't seen anything. Typically, I usually warn patients that they could potentially see some spotting just because when women have atrophic tissue, sometimes even if we just put the speculum in or even a Q-tip, because of the fragile tissue, you can see some spotting. But other than that, most patients are without any complications.
So what have your results been like? Are patients satisfied with this procedure?
Oh, my God, this procedure really is a game changer. Patients have been very happy. I've had women who haven't been able to have intercourse with their husband for 5 years or more, and now after having this treatment, they're able to resume sexual activity. I've had women who have had breast cancer, and they've noticed tremendous results, and they're ecstatic because now they finally have an option without having to consider hormones. And so it's just been a blessing in our practice to finally be able to offer women another option besides hormones.
So are the results long-term, or do patients need a touch-up, and how long does it typically last?
Again, the treatments are 6 weeks apart, and we do 3 of them. And then we usually just recommend that the patient comes in for a yearly touch-up. There have been plenty of patients who are able to go longer than a year and still have good results, but we just have them come in to make sure that everything is still as they would like for it to be. And if it's not, then instead of doing the full 3 course of treatments, we'll usually just do 1.
Do you have any advice that you would offer to your colleagues about the Mona Lisa laser? What are the advantages to the patients as well as to the medical practice?
I think that every gynecologist should really consider this as an option for their practice. I think that there's rarely a time that we have a treatment that we can use that can cause such a tremendous benefit for the patient. And so I think based off the experience of my patients that even though this treatment isn't covered by insurance, they have been more than able and willing to pay for the cost of the treatment. And, I just had a patient that actually called in today, and she was enthusiastic about the results, and she said it was the best use of her funds in a long time. So I definitely think it's an option that every gynecologist should have because it just makes sense to be able to offer this type of treatment to your patient.
So just to clarify, this procedure is not going to be covered by insurance. What's the typical cost to patients?
So typically, 3 treatments is somewhere around about $1,800 to maybe $2,500, depending on what part of the country you're in.
And then touch-up procedures?
Around $500 to $800.
Okay. Well, Dr. Stephens, we're reaching the end of our time together. Is there any additional information you would like to provide to your colleagues?
I just would recommend you take a look. This is a great adjuvant treatment to your practice, and if you're really looking to make patients happy and give them something that could really change their lives, then Mona Lisa Touch is that treatment.
Well, thank you, Dr. Stephens. It was a pleasure to have you with us today.
Thank you.
And to download this podcast and others in this series, please visit reachmd.com. We welcome you to share, like, and comment on this podcast. I am your host, Dr. Patrice Basanta-Henry, and you've been listening to ReachMD. Be part of the knowledge. Thank you for listening.